started. My name is Elizabeth Stelle, and I'm a research associate at the Commonwealth Foundation for Public Policy Alternatives, a nonpartisan educational institute. We're based in Harrisburg. Thank you for inviting us to speak today. I'm going to go through just some of the cost of fraud that's already been mentioned, including some more detail on Auditor Wagner's reports, and then we'll go into some recommendations that we have. Since Governor Rendell took office in 2003, general fund spending on public welfare has ballooned, as you've already seen. In his fiscal year 2010-2011 budget, public welfare is set to receive an increase of $482 million. That would bring the increase in public welfare spending since 2003, just since 2003, to 68.2%, and that's 41.3% when you adjust for inflation. This dramatic increase in expenditures is especially worrisome given the Department of Public Welfare is the focus of constant audits and investigations revealing evidence of widespread abuse and waste. And many of you may remember findings from a recent House Republican Policy Committee investigation uncovering numerous cases of welfare fraud. Auditor Jack General recently uncovered fraud in several state Department of Public Welfare programs that could represent over $1 billion in misspent money. And the programs I'm going to detail include LIHEAP, the Special Allowance Program, and Medical Assistance, or Medicaid. LIHEAP provides grants to households with incomes of up to 150% of the federal poverty line. This means a family of 4 that earns up to $33,000 can receive benefits. 2 audits over 3 years revealed lax procedures, insufficient supervision, and inadequate oversight. And the second audit, as you mentioned, resulted in the arrest of 18 people for stealing more than $500,000 of LIHEAP funds and related crimes. When we come to the Special Allowance Program, they also found the program to be rife with mismanagement and poor oversight, creating an environment for potential fraud and abuse. And this time costing taxpayers up to tens of millions of dollars. And in the case of Medicaid, the Auditor General's office found that DPW failed to make proper eligibility determinations on more than 1,600 randomly selected applications between January 2005 and March 2008. This resulted in $3.3 million in payments to a fraction of ineligible recipients. Many of the improper disbursements were due to DPW's failure to verify their age, disability, and family relationship requirements, and to promptly review recipients' financial and other eligibility information. The total cost of this fraud across the Medicaid assistance program would likely be hundreds of millions of dollars. The bureaucratic nature of DPW exasperates the problem. The incentive structure is such as the department's primary goal is to add to its clientele regardless of need. The more clients they have, the more funding they can obtain, and the greater job security for those bureaucrats. Now to recommendations. Addressing the issues of fraud and waste starts with improving the enforcement of eligibility for DPW programs. However, the Rendell administration seems content to celebrate increasing numbers of Pennsylvanians served by programs, or increasing numbers of Pennsylvanians who are now dependent on government, regardless of whether they are truly needy. Prior to the Rendell administration, approximately 47,000 cases of suspected welfare fraud were referred to annually to the Inspector General. However, between 2003 and 2004, the Inspector General only received about 29,000 referrals. This despite the increase of caseloads. In the past 4 years, the number of referrals have continued to decline, with 25,802 referrals in 2009. Additionally, improving Pennsylvania's whistleblower protection law could help ensure transparency and accountability. 18 states have whistleblower laws that protect private sector workers who report the misuses of government funds, similar to what we saw here today. In addition to these states, Georgia protects healthcare workers who report Medicaid false claims, and South Carolina goes a step further to reward whistleblowers with up to $2,000 if their information saves taxpayers money. The Commonwealth Foundation supports a similar approach to South Carolina, rewarding whistleblowers in the public and the private sector who identify those defrauding our system, saving taxpayers money. Another step the legislature should consider is recovery audits. Recovery audits for improper payments can be used to recoup the cost of fraud in state welfare operations. The American Legislative Exchange Council, or ALEC, has model legislation implementing recovery audits for improper payments. Recovery audits allow private contractors to audit fraud in Medicaid and other programs and collect from those cheating the system. Recovery audits are a nationally recognized best practice for disbursements management and improving operational efficiency. Additionally, recovery audits will not cost the state any resources, as the costs are deducted from any dollars received, making them self-funding. Typically, Medicaid is the largest area where overpayments and fraud are uncovered, but audits have been done in other areas as well. And finally, which we feel is the most important area for reform, Medicaid. Perhaps the most important step lawmakers can take is to overhaul the state's Medicaid program. Medicaid consumes a large part of our state budget and is growing at an unsustainable rate. If the current rate of growth continues, Medicaid will consume 94% of the state budget by 2075. Enacting Medicaid reform could significantly reduce waste and fraud. At the same time, Medicaid is a notoriously low-quality provider of health care. Studies show that those with private health insurance, as well as those without any insurance at all, have better health outcomes than those on Medicaid. Poor quality care is caused by a limited selection of doctors, as Medicaid pays doctors and hospitals less for the same procedures than private insurance companies. The poor quality of Medicaid affects all Pennsylvanians by driving up the cost of private coverage. Allowing Medicaid recipients to have more control over their health care by transitioning from a fee-for-service to vouchers will go a long way to improving service. Specifically, each recipient would be rewarded risk-adjusted credits to purchase health insurance instead of direct payments to medical facilities. Florida, South Carolina, and Louisiana have already adopted this approach. And when individuals have more control over their health care dollars, they use medical services more discriminately. Likewise, providers have more freedom in treating Medicaid enrollees. Specific policies to enact Medicaid reform include creating an insurance and provider exchange system where recipients can shop for coverage and replace the fee-for-structure of Medicaid payments, allowing Medicaid credits to be used for premium assistance, which is combined with their individual or employer payments. As you can see, our recommendations would reduce fraud and waste because the credits would be income adjusted, and determining eligibility would be a regular, albeit required, part of the Medicaid exchange. Furthermore, private insurers serving Medicaid recipients would be an incentive to crack down on improper billings and abuse by recipients and providers. Welfare advocates justify spending increases by emphasizing that they're necessary to provide for Pennsylvania's vulnerable citizens. This includes children, older adults, and the disabled. However, we must consider the efficiency and outcomes of such programs. If resources are being squandered on those who do not need them and are defrauding the system, both welfare recipients and taxpayers will benefit from the above welfare reforms. Thank you for your time, and I'll now take your questions.